Emergency Physicians Professional Association was founded 50 years ago by a group of innovative doctors who had a radical vision to transform patient care. Since then, EPA providers have cared for millions of patients of all ages with every kind of ailment you can think of. We've resuscitated the dying and watched new life emerge. We've seen life's tragedies and witnessed unexpected recoveries. In the past 50 years, our providers have been at the forefront and on the front lines of emergency medicine, pushing ourselves to serve our patients and our hospital partners with excellence. To get a sense of why EPA is one of only a few independent medical groups with such longevity, here's a look at our distinctive history. In the days before emergency medicine was a board-certified specialty, hospital emergency rooms were often just one room. Doctors of all backgrounds came in to help, even if they had no relevant experience. Something had to change. And pioneering physicians across the country heard the call for help and responded. 4 of those doctors lived here in Minnesota. And in March 1969, Doctors Jim Anderson, Reuben David, Charles Kelly, and Solomon Zach started Emergency Physicians Professional Association to staff local hospital emergency rooms with physicians trained in emergency medicine. In what was a new and innovative arrangement, EPA began running and staffing the emergency department with our first partner, Methodist Hospital in St. Louis Park. The partnership with Methodist was so successful that EPA quickly began running the emergency departments in other locations throughout the 1970s. Our partnership with Allina Health Mercy Hospital Unity Campus began in 1970. In 1971, Hennepin County Medical Center launched a residency program in emergency medicine, only the second program in the nation. EPA hired its graduates as quickly as possible as we expanded into 3 more sites: Fairview Southdale Hospital, Allina Health Mercy Hospital, and Fairview Ridges Hospital. By 1980, 4 out of 7 EPA physicians were trained in the newly emerging field of emergency medicine. But it would still be another decade before ER physicians could become board certified. During the 1980s, EPA providers kept up with the latest advancements in emergency medicine through quarterly educational forums hosted by leaders within the organization. By showing that dedication to the practice of emergency medicine year after year, EPA became a trusted partner. In fact, EPA physicians were placed in high-ranking leadership positions within the hospitals we partnered with, a trend that continues today. Delivering excellent care was always a priority, and in the 1990s, EPA began quality improvement and risk management initiatives within each of the emergency departments we ran to push emergency medicine even further. The 1990s also marked a period of change for EPA outside the hospital. Leaders focused on the economics of healthcare in order to consistently recruit the best emergency physicians in the region. This fundamental economic intelligence continues today and allows us to provide necessary emergency care irrespective of a patient's ability to pay for it. This dedication to quality care and provider practice solidified EPA as a group and set us apart from our competitors. In 1996, EPA's Board of Directors approved the appointment of the first Director of Quality, clearly demonstrating the group's intention to promote the highest quality care for all patients treated by every EPA provider. The focus on quality, cutting-edge care enabled EPA to expand the range of care delivered by EPA providers, reducing the need for on-call specialists to treat patients in the ER, and in appropriate situations, reducing the need for hospitalizations. 3 examples include emergent intubation for breathing failure, electrical cardioversion for major heart rhythm abnormalities, and extremity fracture realignment with procedural sedation. All of these procedures once required specialists to come to the ER or required hospitalization of the patient for delayed treatment. In the late 1990s, EPA physicians began treating those patients right away. At the turn of the millennium, EPA became a certified continuing medical education provider through the American Medical Association, so we could offer robust educational programs in emergency medicine topics to our providers. At the same time, EPA also introduced guidelines to limit opioid prescribing, long before opioid use became such a crisis. In the early days, our chronic pain policy was controversial among some physicians, but is now another example of the innovative thinking of our group. In addition to pushing the care of patients forward, EPA leaders worked hard to protect the providers who served so diligently. At a time when medical malpractice insurance became unaffordable, EPA opted to self-insure. This required exceptional care of our patients by our physicians. We were able to see ourselves through that difficult time when many other independent groups were not. As technology accelerated and the electronic health record became the way to manage a patient's care and document patient visits, EPA providers noticed they spent a lot less time connecting with patients at the bedside. This trend drastically decreased physician job satisfaction and patient satisfaction across the country. Once again, the innovative minds at EPA realized they needed to come up with a solution and launched the EPA Scribe program to provide documentation support during patient visits. In the 2010s, EPA physicians watched as local hospital ERs were stretched to maximum capacity. They realized they could serve patients in a groundbreaking new way. They decided to create a freestanding facility where they could practice emergency medicine outside the hospital setting. The idea was originally met with skepticism because no one had done anything like it in the region. But that didn't deter EPA. They first opened the urgency room in Woodbury, where they served 7,604 patients in the first year. Within the next few years, those numbers would rise dramatically as the concept caught on and expanded to 2 more locations in Eagan and Vadnais Heights. Today, the urgency room has more than 80,000 patient visits a year. Patient volumes at our hospital partner emergency departments and the urgency room increased every year, sometimes more than 20%, and showed no signs of slowing down. It became increasingly difficult to see patients in a timely manner. EPA saw a growing need to hire advanced practice clinicians who they could train in emergency medicine to help give care even faster. In 2014, EPA created the Advanced Practice Clinicians Training Program for physician's assistants and nurse practitioners, and within 4 years, 36 advanced practice clinicians had joined EPA's physicians in a team-based approach to the delivery of emergency care. For most of its half-century, EPA provided care within the Twin Cities, but in 2016, EPA leaders saw Minnesota hospitals outside the Twin Cities struggling to keep up with patient volumes and quality initiatives. EPA once again saw a need for excellent emergency care and began to partner with hospitals across the state. CentraCare Health St. Cloud Hospital was EPA's first partner outside the Twin Cities. Within the year, EPA teamed up with Allina Health Buffalo Hospital and made plans to continue expanding. In 2017, EPA partnered with Allina Health Cambridge Medical Center. We were asked to provide the leadership of their ED with an EPA medical director in a pilot program. It was a success, and EPA was asked to run the ED the following year. EPA teamed up with 3 more hospital partners in 2018, Health Partners Hutchinson Health and North Memorial Health's Maple Grove Hospital and Level 1 Trauma Center in Robbinsdale. With so much expansion happening, EPA moved into new headquarters in Bloomington with plenty of space to grow. The new offices feature a training facility and advanced technology, allowing our remote scribes to support our providers in locations outside the metro. And now, as we turn 50, we're proud that our innovative spirit is as strong as ever. We're expanding our partnerships with hospitals to bring them cutting-edge acute care. We're launching a data analytics platform to help us evaluate our opportunities for improvement and standardization. And we're starting a provider wellness program to ensure the health and well-being of our providers. As we look forward to our future, we see a horizon full of possibilities, and we're grateful we've had so many opportunities to serve. As Sir William Osler said, the practice of medicine is an art and a calling, and EPA will continue to answer the call to deliver the highest quality emergency medicine possible.